What are the key principles to follow when performing first aid for an animal with a fracture, and how should you manage the injury until professional help arrives? Answer: when managing a fracture in an animal, the primary goal is to prevent further injury, manage pain, and stabilize the animal until veterinary assistance is available. Here are the key steps to follow. Assess the situation, evaluate the animal's condition, making sure it is safe for both the animal and the handler. Control bleeding. If the fracture is open and bleeding, use a clean cloth or bandage to apply gentle pressure to stop the bleeding. Immobilization. Immobilize the fractured limb to prevent movement that could worsen the injury. A splint made of rigid material, e.g. wood or metal, can be used to stabilize the limb. The splint should extend above and below the fracture site. Pain management. If pain is suspected, avoid applying excessive pressure and limit the animal's movement. Do not attempt to reposition the bones. Transport to a vet. Once the fracture is stabilized, transport the animal to a veterinarian immediately. It is critical to transport the animal in a manner that avoids jarring or disturbing the injury. How can you identify the early symptoms of leptospirosis in animals, and what immediate actions should be taken if you suspect an animal has been infected? Answer: leptospirosis is a zoonotic disease caused by bacteria from the genus Leptospira, and animals, particularly rodents, dogs, and livestock, can carry it. Early signs of leptospirosis in animals include lethargy. Animals may appear tired and inactive. Fever. Elevated body temperature is common. Vomiting and diarrhea. Gastrointestinal symptoms often accompany the disease. Jaundice, yellowing of the skin and mucous membranes may indicate liver damage, increased thirst and urination. The kidneys may be affected. If you suspect an animal has leptospirosis, isolate the animal. Leptospirosis is zoonotic, meaning it can be transmitted to humans. Isolate the infected animal to reduce the risk of spreading the bacteria. Contact a veterinarian immediately. Prompt veterinary care is essential. Antibiotics can be effective in the early stages of infection. Wear protective gear. Wear gloves, face masks, and other protective equipment to minimize the risk of transmission to humans. Mr. Smith, a wildlife control officer, is responding to a call about a fox that has become trapped in a residential backyard. Upon arrival, Mr. Smith finds the fox visibly distressed and attempting to escape from a small cage. What steps should Mr. Smith take to safely handle and transport the fox to ensure its safety and avoid injury? Answer: Mr. Smith should follow these steps. Assess the situation. Ensure his safety and that of the fox. Foxes can be unpredictable when scared or cornered. Wearing protective gloves and using appropriate equipment is crucial. Calm the animal. Speak softly and move slowly to avoid further distress. If the fox is in a cage, consider placing a cloth over the cage to reduce stimulation. Prepare for capture. Use a net or humane trap, ensuring the fox is safely contained before removal. Avoid direct physical contact with the fox unless absolutely necessary. Evaluate health status. Look for any signs of injury or illness. If the animal appears sick or injured, contact a veterinarian immediately for proper care. Transport guidelines. Ensure the cage or transport container is sturdy, well ventilated, and secure. The fox should be transported in a manner that minimizes stress and injury. Transport should be as direct as possible to avoid unnecessary delays. Follow legal requirements. Mr. Smith should ensure that the transportation and handling of the fox comply with wildlife protection laws and local regulations. What is the purpose of using tranquilizers during animal capture, and what are the potential risks involved in their use? Answer: tranquilizers are used to safely subdue animals during capture, especially in situations where the animal is dangerous, stressed, or difficult to control. The primary purpose is to reduce aggression. Some animals may become aggressive or defensive when captured, and tranquilizers help calm them down, making the capture process safer. Prevent injury. By immobilizing the animal, tranquilizers reduce the risk of the animal injuring itself or the handler during the capture process. Facilitate safe transport. Tranquilizers allow for safe handling and transport, particularly for larger or wild animals that may not easily be contained. However, the use of tranquilizers carries risks. Overdose or underdose. The wrong dosage can be lethal or ineffective. The animal may not be fully immobilized, increasing the risk of injury to both the animal and handler. Side effects. Tranquilizers can cause adverse reactions, including respiratory depression, heart issues, or allergic reactions. Legal and ethical considerations. The use of tranquilizers must comply with local wildlife laws, ethical guidelines, and veterinary recommendations. What are the guidelines for transporting an injured animal, and how should you ensure its welfare during the journey to the vet? Answer: when transporting an injured animal to a vet, the welfare of the animal is paramount. Here are the guidelines to follow. Secure and comfortable transport container. Use an appropriate sized carrier or box that allows the animal to be comfortably contained while minimizing movement. The container should be well ventilated and provide a stable surface, minimize stress, keep the environment as calm as possible, avoid sudden movements, loud noises, or exposure to other animals that could cause additional stress. If the animal is conscious, provide comfort and ensure the area is dimly lit, prevent further injury. If the animal has an injury, g. broken limb, it should be properly immobilized using a splint or bandage to avoid exacerbating the damage. Monitor the animal throughout the journey, observe the animal's condition. If it is unconscious or having difficulty breathing, be prepared to perform basic first aid such as CPR. Follow transport laws and guidelines. Ensure that the transportation adheres to any local regulations regarding the transport of injured animals. How do you recognize the symptoms of heat exhaustion in animals, and what steps should you take to treat it immediately? Answer: heat exhaustion occurs when an animal's body becomes overheated and cannot regulate its temperature effectively. Its symptoms include excessive panting or drooling, weakness or lethargy, rapid breathing or heart rate, vomiting, disorientation, or loss of coordination. If heat exhaustion is suspected, move the animal to a cooler environment. Get the animal out of direct sunlight and into a shaded or air-conditioned area. Hydration. Offer fresh, cool, not cold water for the animal to drink. Do not force water into its mouth, but allow it to drink voluntarily. Cool the animal. Use cool, damp towels to gently wipe the animal's body, especially around the head, paws, and abdomen. Avoid using ice-cold water as it can cause shock. Monitor the animal. Observe the animal closely. If the symptoms do not improve or worsen, seek immediate veterinary care. When setting humane traps for wildlife, what are the key considerations to ensure the safety and well-being of both the animal and the handler? Answer: setting humane traps requires careful consideration to ensure both the safety of the animal and the handler. Key considerations include choosing the right trap. Select traps that are appropriate for the species you are targeting. Traps should be sturdy, large enough to prevent injury, and capable of capturing the animal without causing harm. Placement of traps. Place traps in areas where the animal is likely to be, e.g., along animal paths, near food sources, but avoid areas where the trap could cause harm to non-target animals or pets. Baiting the trap. Use appropriate bait to attract the target species, ensuring that the bait is secure and does not pose a risk to the animal. Check traps regularly. To minimize stress and injury to the animal, check the traps frequently. Animals should not be left in the trap for extended periods, especially during extreme weather conditions. Handling the animal safely. Wear gloves and use protective equipment when handling trapped animals. Avoid sudden movements that could scare the animal and cause injury to itself or the handler. What are the legal and ethical responsibilities of an animal control officer when responding to a call involving a potentially dangerous animal? Answer: an animal control officer has both legal and ethical responsibilities when responding to a potentially dangerous animal. Ensure public safety. The officer must prioritize the safety of the public and the animal. This includes assessing the situation and determining whether lethal force is necessary or if a non-lethal solution, e.g., tranquilizers or capture, is possible. Follow local animal control laws. The officer must adhere to local animal control laws, which may include restrictions on how certain animals can be handled or captured. For example, some regions may require specific permits for capturing certain species or using tranquilizers. Ethical considerations. Animal control officers must follow ethical guidelines that emphasize humane treatment. This includes ensuring the animal's welfare during capture and transportation, using the least invasive methods, and minimizing suffering. Documentation and reporting. Officers are required to document the incident, the steps taken, and any outcomes. This documentation is vital for legal compliance and accountability. What specific risks are involved when transporting large or aggressive animals, and how can these risks be mitigated during transit? Answer: transporting large or aggressive animals involves several risks, including injury to the animal. Large animals may try to break free from transport containers, causing self-injury. Injury to the handler. Aggressive animals may attempt to bite or scratch handlers during the transport process. Stress and panic. The animal may become stressed, which could lead to erratic behavior and increased risk of injury. To mitigate these risks, secure the animal properly. Use strong, secure transport cages or crates that prevent the animal from moving excessively. Sedation or tranquilization. If recommended by a veterinarian, consider using mild sedation to calm the animal and make transport safer. Padded or cushioning. Ensure that the animal's transport space is padded to prevent injury from sudden movements. Avoid direct contact. Use equipment like poles or shields to handle the animal without direct contact. How do you recognize the symptoms of rabies in animals, and what are the legal requirements for handling a potentially rabid animal? Answer: rabies is a fatal viral disease that affects the nervous system and can be transmitted to humans and other animals. Symptoms in animals may include behavioral changes. Animals may become unusually aggressive, or alternatively, they may show signs of confusion or paralysis. Hydrophobia, difficulty swallowing and excessive drooling, often linked with fear of water. Seizures and paralysis. Rabies can cause tremors, seizures, and paralysis in its final stages. Other symptoms: fever, difficulty moving, and unusual vocalizations. If you suspect an animal has rabies, avoid contact. Do not approach the animal. Rabid animals are highly dangerous and can transmit the disease through bites or saliva. Notify authorities. Contact local animal control or public health authorities immediately. Rabies is a reportable disease and there are specific protocols to follow. Legal requirements. In many jurisdictions, if a potentially rabid animal is found, it must be quarantined for observation or euthanized. Animal control officers must follow legal procedures to ensure public health and safety. Feral cats are a significant pest species in many ecosystems. What are the ecological consequences of feral cat populations, and which control methods are both ethical and effective? Provide a detailed explanation of how these methods align with the Animal Welfare Act and other relevant regulations. Answer: feral cats pose significant ecological threats, including biodiversity loss. Feral cats predate on native species, causing population declines or extinction in vulnerable species, particularly small mammals, birds, and reptiles. Ecosystem imbalance. They can disrupt the food chain, leading to overpopulation of certain prey species. Disease transmission. Feral cats may carry diseases such as toxoplasmosis, which can infect humans and wildlife. Ethical and effective control methods include trap, neuter, return, TNR programs capture feral cats, sterilize them, and return them to their habitat to prevent further breeding. TNR is supported by welfare principles as it reduces the population without killing, aligning with the Animal Welfare Act 2006 guidelines on humane treatment. Targeted removal in sensitive areas. In ecologically sensitive zones, controlled removal may be necessary. This must comply with local Wildlife Protection Act to avoid harming native species during control operations. Community education. Encouraging responsible pet ownership prevents feral populations from growing. Regulations, such as mandatory microchipping and desexing laws, support these efforts. Ethical considerations mandate the avoidance of inhumane methods, such as poisoning, as these contravene animal cruelty laws under the Prevention of Cruelty to Animals Act 1986. Ms. Harper, a local farmer, has observed a dramatic decline in small native mammal populations on her property. After investigating, she finds evidence of non-native foxes and rabbits heavily impacting the area. Ms. Harper wants to implement pest control measures but is unsure of the legal and environmentally responsible steps she should take. What actions should Ms. Harper take to address the pest issue, and what legal and ecological considerations must guide her decisions? Answer: Ms. Harper should take the following steps. Consult local authorities. Engage with local pest control or environmental agencies to ensure her methods comply with laws such as the Biosecurity Act 2015 and any regional pest control regulations. Apply integrated pest management (IPM). For foxes, use targeted trapping and euthanasia methods approved under the Wildlife and Conservation Act 1950. Consider guardian animals, e.g. Merrimer dogs, to protect livestock while deterring foxes. For rabbits, implement biological controls, e.g. Myxomatosa activae, where legally permitted. Avoid broad-spectrum poisoning. Poisons like 10-80 should be applied with caution and only under professional guidance to avoid secondary poisoning of non-target species. Habitat restoration. Restoring vegetation can reduce the impact of pest species by strengthening native species resilience. Discuss the public health consequences of rodent infestations in urban settings and evaluate the effectiveness and legal compliance of using rodenticides versus natural predators for control. Answer: rodent infestations pose significant public health risks, including disease transmission. Rats and mice can spread diseases such as leptospirosis, hantavirus, and salmonella. Food contamination. Rodents can contaminate food supplies, causing outbreaks of foodborne illnesses. Infrastructure damage. Gnawing on wires and pipes can lead to costly repairs and hazards like fires or flooding. Control methods. Rodenticides. Rodenticides are effective but have risks of secondary poisoning to predators and pets. Compliance with the Environmental Protection Act 1990 is essential to ensure proper application and disposal of toxic substances. Some rodenticides are banned under the Hazardous Substances and New Organisms Act 1996 due to their environmental impact. Natural predators. Encouraging urban raptor populations, e.g. owls, provides sustainable control. This method aligns with biodiversity conservation laws. What protocols should be in place for intake procedures at animal shelters, and how do these protocols ensure compliance with health and welfare standards? Answer. Animal shelter intake protocols include health assessment, conduct thorough medical examinations to identify contagious diseases, injuries, or parasites, quarantine newly admitted animals as per veterinary public health guidelines to prevent disease spread, record keeping, maintain detailed records of the animal's condition, microchip details, vaccination history, and surrender reason. Compliance with data protection regulations ensures sensitive information is handled securely. Behavioral assessment, evaluate temperament to determine suitability for adoption or additional rehabilitation. Vaccination and deworming, administer necessary vaccinations and deworming treatments immediately. This aligns with local animal health regulations. These measures uphold animal welfare standards and facilitate effective rehoming. A newly admitted dog at Green Valley Shelter shows signs of aggression. The staff is concerned about its adoptability. While the shelter manager insists on euthanasia for safety reasons, a volunteer argues for rehabilitation efforts. What steps should the shelter take to address the situation ethically and legally? Answer. The shelter should conduct a comprehensive assessment, seek a veterinarian and behaviorist's opinion to evaluate the dog's aggression triggers, implement a rehabilitation plan. If aggression stems from fear or past trauma, training programs may improve behavior. Rehabilitation aligns with the code of practice for the welfare of dogs. Consider safety protocols, ensure proper handling by trained staff, and avoid public interactions until the dog's behavior is evaluated. Euthanasia is a last resort. If the dog poses an irreparable danger, humane euthanasia must follow Animal Welfare Act standards to minimize suffering. The decision must balance public safety, animal welfare, and ethical considerations. What are the key differences between biological control and chemical control methods in pest management, and what are the legal and ethical concerns associated with each? Answer. Biological control and chemical control represent two distinct approaches to pest management. Biological control involves the use of natural predators, parasites, or pathogens to control pest populations. Examples: introducing natural predators, e.g. using ladybugs to control aphids, releasing diseases such as myxomatosis to control rabbit populations. Legal considerations: must comply with regulations under the Biosecurity Act 2015, which governs the introduction of non-native species to prevent ecological imbalances. It's important to ensure that the introduced species does not become invasive itself. Chemical control involves the use of pesticides or rodenticides to reduce pest populations. Examples: using poisons to control rats or insects. Legal considerations: must follow the National Registration Scheme for agricultural and veterinary chemicals to ensure safe application. There are concerns about the non-target impact of pesticides, which can affect other species and ecosystems. The Hazardous Substances and New Organisms Act 1996 controls the registration and use of such chemicals to minimize these risks. Ethical concerns: biological control is often seen as more ecologically responsible, provided it is carefully managed, while chemical control methods are considered more disruptive to ecosystems. Both require consideration of environmental impacts and long-term sustainability. Mr. Thompson has been managing a vineyard for several years and has noticed an increasing problem with invasive rabbits that are damaging his crops. After contacting local authorities, Mr. Thompson is offered two options: biological control, releasing a specific virus, or chemical control, using a pesticide. He is concerned about the long-term impact on the environment and surrounding wildlife. What should Mr. Thompson consider when choosing between biological and chemical control methods, and what steps should he take to ensure compliance with legal and ethical standards? Answer. Mr. Thompson should carefully consider the following factors: ecological impact, biological control, assess the long-term impact of releasing a virus, ensuring that it will not harm non-target species. This approach must comply with the Biosecurity Act 2015 and local environmental regulations. He should check that the virus is native to the area and poses no risk to the broader ecosystem. Chemical control assess the risks of pesticide poisoning to non-target animals and the environment. He should ensure that any chemical used complies with the National Registration Scheme for Agricultural and Veterinary Chemicals and follow all usage guidelines. Effectiveness and cost. Biological control might be slow, but offers a sustainable long-term solution. Chemical control might offer a quick fix, but can lead to resistance over time and requires regular application, ethical and legal compliance. Both methods require proper training for application and adherence to Animal Welfare Act guidelines to ensure humane treatment of animals. He should also consider Wildlife Protection Act regulations concerning the introduction of foreign species into the environment. In the context of managing invasive species, explain the precautionary principle and its relevance to decision-making in pest control strategies. Answer: the precautionary principle is a guiding framework that emphasizes erring on the side of caution when there is uncertainty about potential environmental harm. The principle states that when an action or policy has a suspected risk of causing significant harm to the environment, the burden of proof falls on those advocating for the action rather than those opposing it. Relevance to invasive species management. When deciding on pest control strategies, e.g., introducing a new predator or applying chemicals, this principle suggests that if there is uncertainty about the long-term impacts, the action should not be taken without further research or mitigation measures. For instance, when releasing a biological control agent like a virus or predator, the precautionary principle dictates that it should be thoroughly tested for its potential effects on non-target species before release. This principle is embedded in regulations such as the Biosecurity Act 2015 to prevent unintended consequences that could result in greater ecological harm. The precautionary approach ensures that decisions are made with caution and accountability, reflecting the responsibility to preserve the environment for future generations. What are the core components of hygiene standards in animal shelters, and how do these protocols help maintain animal health and prevent disease outbreaks? Answer: hygiene standards in animal shelters are essential for the health and welfare of animals and to prevent the spread of zoonotic diseases. Key components include cleaning schedules. Shelters must establish regular cleaning routines for all areas, including kennels, play areas, and medical facilities. High-traffic areas should be cleaned multiple times a day, while less used areas can be cleaned less frequently. Use of disinfectants effective against a broad spectrum of pathogens is crucial. Regular cleaning reduces the risk of infection transmission between animals and from animals to humans. Quarantine procedures. New animals or those showing signs of illness should be quarantined in separate, isolated areas until they are medically cleared. This prevents outbreaks of diseases like parvovirus, distemper, or respiratory infections. Quarantine areas should be equipped with separate supplies to avoid cross-contamination. Personal protective equipment (PPE). Shelter staff should wear gloves, masks, and protective clothing when handling animals to prevent the spread of infectious agents. Pest control. Regular pest control measures, such as bait stations for rodents and fly traps, should be in place to avoid infestations that could carry disease. These hygiene protocols help prevent the outbreak of diseases and ensure that animals remain healthy while awaiting adoption or recovery. Compliance with public health and safety regulations is crucial for maintaining shelter hygiene standards. A local animal shelter is facing an issue with a high volume of incoming animals, including stray dogs, abandoned cats, and injured wildlife. Due to limited space and resources, the shelter is struggling to maintain proper hygiene standards. Staff have raised concerns about the risk of disease outbreaks due to inadequate cleaning practices. What steps should the shelter take to improve hygiene standards and ensure compliance with legal and health regulations while managing the high intake of animals? Answer: the shelter should take the following steps to improve hygiene standards and ensure compliance. Increase cleaning frequency. Adjust cleaning schedules to ensure high-risk areas, e.g., kennels, medical wards, are cleaned multiple times a day. Implement a cleaning rotation to focus on areas with the highest turnover. Enhance quarantine procedures. Create separate quarantine spaces for incoming animals, particularly those with signs of illness. This will help prevent cross-contamination and protect both incoming and existing animals. Improve resource allocation. Seek additional funding or community donations to improve shelter resources. This might include hiring temporary staff or recruiting volunteers to handle cleaning duties. Staff training on hygiene protocols. Ensure that all staff members are trained in best practices for animal hygiene, disease prevention, and the use of disinfectants and PPE. Consult with veterinarians. Have a veterinarian regularly inspect the shelter's protocols, providing advice on preventing the spread of diseases like kennel cough or ringworm. Sarah, an animal control officer, arrives at the scene of a flood-affected area where a temporary shelter has been set up for displaced animals. She notices that some animals are showing signs of stress and dehydration. The veterinarian on site is busy attending to critical cases, and there is a lack of clear documentation regarding the animals' medical needs. What steps should Sarah take to ensure the health and safety of the animals while maintaining the shelter's efficiency? Answer: Sarah should take the following actions. Assess the animal's immediate needs, identify the most stressed and dehydrated animals and prioritize their care. Administer water and food as per the standard operating procedures for emergency shelter care. Coordinate with shelter volunteers. Delegate tasks such as recording animal intake details, feeding schedules, and hydration monitoring to ensure all animals receive care. Establish communication with the veterinarian. Provide the veterinarian with a concise update on the animal's condition, focusing on those that require urgent medical attention. Create the temporary documentation system. Use a simple, standardized form to record animal details, such as species, observed symptoms, and care provided. Follow emergency response guidelines. Ensure compliance with laws such as the Animal Care and Protection Act 2001, which mandates providing adequate care and preventing unnecessary suffering during emergencies. What are the primary considerations when planning for an animal evacuation during a wildfire, and how do these considerations align with relevant legislation? Answer: when planning an animal evacuation during a wildfire, the following considerations are essential. Safety and accessibility. Identify safe evacuation routes and ensure transport vehicles are suitable for the species being evacuated. Identification and documentation. Use collars, tags, or microchips to identify animals and maintain a detailed log of their evacuation and sheltering. Emergency supplies. Prepare adequate food, water, medications, and first aid kits for the animals. Stress management. Use calming techniques to minimize animal distress during transit. Regulatory compliance. Ensure adherence to the Animal Welfare Act 2006, which emphasizes the duty of care and humane treatment during emergencies. Proper planning prevents logistical challenges and ensures compliance with legal responsibilities, safeguarding both animal welfare and public safety during wildfire evacuations. An animal control officer is tasked with administering medication to a large dog under the veterinarian's supervision. What steps should the officer follow to ensure accuracy and compliance with regulations? Answer: the officer should verify the prescription, check the medication label for the correct dosage, expiration date, and administration method. Follow the veterinarian's instructions. Ensure the dose and administration method, oral, topical, etc., are as prescribed. Restrain the animal safely. Use appropriate techniques to prevent injury to both the animal and the handler. Document the administration. Record the medication name, dose, time, and any observed reactions. Monitor for adverse effects. Report any signs of distress or unusual behavior to the veterinarian immediately. Adherence to these steps aligns with regulations like the Veterinary Surgeons Act, ensuring safe and lawful medication practices. Carlos is setting up a temporary shelter after a major storm displaced dozens of pets. He notices that the shelter lacks proper ventilation and the cages are overcrowded. Additionally, there is no clear separation between sick and healthy animals. What should Carlos prioritize to manage the shelter effectively while adhering to animal welfare guidelines? Answer: Carlos should improve shelter conditions, enhance ventilation to prevent respiratory issues and reduce overcrowding by organizing more space or additional enclosures, segregate animals, separate sick animals from healthy ones to prevent the spread of disease, creating isolation areas if necessary, sanitize regularly, establish strict cleaning protocols to maintain hygiene, document animal details, record information such as health status, intake date, and any treatments administered, follow legal standards, ensure compliance with local shelter management laws and the code of practice for the welfare of animals in shelters. By addressing these issues, Carlos ensures the shelter operates efficiently and complies with welfare regulations, prioritizing the animals' health and safety. Explain the importance of collaborative skills when working with veterinarians to develop treatment plans for injured animals. Answer: collaborative skills are critical because they facilitate clear communication, ensure that the veterinarian understands the animal's condition, history, and environment, leading to an accurate diagnosis. Enhance treatment outcomes. By sharing observations and feedback, animal control officers can help refine treatment plans. Promote teamwork. A cooperative approach fosters trust and efficiency between all parties involved in animal care. Effective collaboration adheres to the principles outlined in the Veterinary Practice Guidelines, ensuring animal welfare through shared expertise and resources. What are the ethical considerations for administering sedatives to animals during rescue operations, and which laws govern such practices? Answer: ethical considerations include necessity: use sedatives only when necessary to ensure safety or minimize stress. Veterinary supervision: administer sedatives under the direct guidance of a licensed veterinarian. Documentation: record the sedative type, dosage, and administration time. Relevant laws: Animal Welfare Act ensures the humane treatment of animals during emergencies. Veterinary medicines regulations governs the prescription and administration of sedatives. These practices ensure the ethical and legal administration of sedatives, prioritizing animal welfare and safety. Emily notices a horse at a disaster site showing signs of severe dehydration and heat exhaustion. The veterinarian is unavailable, and Emily must act quickly to stabilize the horse. What immediate steps should Emily take, and what legal guidelines should she follow? Answer: Emily should provide shade, move the horse to a cooler area to reduce heat stress, administer water gradually, offer small amounts of water to prevent shock, monitor the horse, watch for signs of recovery or deterioration, seek veterinary assistance, contact the veterinarian for further instructions. Legal guidelines: follow the Animal Welfare Act, which mandates prompt and appropriate action to alleviate suffering. Quick intervention aligns with legal and ethical standards, ensuring the horse's immediate welfare. What key factors should an animal control officer consider when setting up a disaster response plan for animals in flood-prone areas? Answer: key factors include risk assessment. The officer should conduct an assessment to identify flood-prone zones and vulnerable species, ensuring preparedness for potential evacuations. Resource planning: stockpiling necessary supplies like food, water, and medical resources is crucial for both immediate and long-term care. Shelter arrangements: temporary shelters should be identified with consideration for elevated locations to avoid floodwaters. Community coordination: coordinating with local authorities and other agencies ensures that all available resources are utilized and response efforts are streamlined. Compliance with legal requirements: the officer should ensure the disaster plan aligns with the Emergency Management Act and Animal Welfare Act, which require coordinated responses and the provision of adequate care. These considerations ensure that animal welfare is maintained throughout the disaster response. Describe the role of documentation in administering medications during a disaster. Answer: documentation plays several vital roles. Accountability: it ensures that each animal receives the correct medication and dose, preventing errors that could harm the animal. Tracking treatments: accurate records help track the effectiveness of the medication and any side effects, which is important for future care decisions. Legal compliance: the veterinary medicines regulations require detailed documentation of medication administration for accountability and legal compliance. Communication: proper records help facilitate communication between animal control officers, veterinarians, and other responders, ensuring continuity of care. By keeping detailed and accurate records, animal control officers meet both ethical and legal standards while providing optimal care. During a rescue operation, an officer finds an injured cat trapped in debris. The officer is unable to access a veterinarian immediately and must decide whether to administer pain relief. What factors should the officer consider, and what ethical guidelines should they follow? Answer: the officer should consider the severity of the injury. Pain relief should only be administered if the injury is severe enough to cause distress to the cat. Availability of resources: if the officer has access to appropriate pain relief, they can proceed with caution. If not, the officer should focus on safely transporting the cat to a veterinary facility. Veterinary guidance: even without direct access, the officer can seek remote guidance from a veterinarian on how to manage pain safely. Ethical guidelines: the Animal Welfare Act requires officers to minimize suffering, but pain relief should not be administered unless the officer is trained to do so. These factors ensure that the officer's actions are both humane and legally sound.